Thank you. Senator Cortez Masto.
Thank you, Mr. Chairman, and to our ranking member. Dr. Oz, good to see you again. Thank you for taking the time to visit with me in my office, and welcome to your family. Let me start with this question. There's a couple, man and woman. They're married. They have a daughter. They're both working hard every day, but their daughter has a rare disease. Unfortunately, the only way they can afford her medical care and treatment is with the help of Medicaid. Would you think that this couple should be taken off Medicaid?
As you describe it, no.
And that's a bulk of the people that I hear from every day that need Medicaid. It's not what some of my colleagues are talking about, these people milking the system. It is true hardworking families that need help, because you've said it earlier, healthcare in this country is just too costly. There's not enough access, it's not affordable, and we've got to do a better job of addressing it. But until we do, we can't kick people to the curb when they need help for their kids in this instance. Let me also address something else here, which I just find offensive in so many ways. As my colleagues looking across the aisle at, I see two of my colleagues sitting between me and Ben Ray. Would you, I don't even know if my colleagues know this. Do you know how many Medicaid fraud units actually exist in the states to go after Medicaid fraud and prosecute for abuse? You don't?
I don't.
So it's in, so you should know, because there are 53. There are 53 Medicaid fraud units. They cover every state, District of Columbia, Puerto Rico, and the U.S. Virgin Islands. And in 2024, they recovered $1.4 billion in fraud. Now, granted, most people, and I have not even heard this from my colleagues, that fraud was provider fraud. That was provider fraud. So I am all about addressing waste, abuse, and fraud, but let's be real here in how we do it and make sure now we're not kicking this couple and their needs for their daughter off of Medicaid because we have some concept which is false about who it is actually benefiting. I also want to jump back here real quick. Senator Langford, he has concerns about nursing homes closing in rural America. So do I, absolutely. In rural Nevada, I have concerns. But I also like to note that cutting Medicaid the way that my colleagues and Republican leadership want to do, which they are proposing, would also close nursing homes in rural America, including in Nevada. It would close hospitals, and it would close clinics. So that is something we have to keep in mind. And the reason why I bring this up is because, like Senator Langford said, in my state, if they don't have it in rural Nevada, they are driving 4 hours to get it somewhere else. That's ridiculous. And that's why I support your conversation around telehealth. I think it's important. Senator Dades and I support it together. It's bipartisan support. We need it. We need to make it permanent. There's so much that needs to be done to address health care. And one of the things that I want to bring up is the ACA tax credits. We currently have in Nevada the lowest uninsured rate in our nation's history, thanks in part to the ACA marketplaces, which helped over 24 million get coverage last year, many with tax credits to lower their premium costs. If Republicans refuse to work with Democrats to extend these credits, costs will skyrocket and people will lose coverage. In Nevada alone, 85,000 people could see hikes or thousands of dollars, forcing them to drop their insurance. And the health insurance market will destabilize. So Dr. Oz, if confirmed, do you agree that Congress must extend these tax credits to prevent massive premium hikes and coverage losses for working families?
Senator, if confirmed, I need to learn more about the specifics of how much additional resources are required and for what parts of the system. But directionally, I like the idea of having transition programs to get folks who are able to work but are on Medicaid for whatever reason. They have a family member that's ill, they've fallen ill and lost their job and lost their insurance. It's wise for us as a nation, as we take care of them, to get them back on their feet and then transition them to programs where they can actually afford the insurance. If you can't afford the insurance, you just go without coverage. So can I stop you there? Because now your assumption is that it is people who are not working that are accessing Medicaid. And I just told you there's a good segment, over 66% or more, that are actually working and getting this benefit.
So I would hope that you would keep that in mind as you go back to study this issue, and I would want you to study all of the facts, because we don't want to harm people that we are actually providing an essential benefit to, and they are working. They are working. My time is up. Thank you.